All right, this is one of those rare treats. Joining me now in studio is the NBC News correspondent Antonia Hilton. She is the author of an important new book, Madness, Race, and Insanity in a Jim Crow Asylum. Great to see you, my friend. Thank you for being here. We don't see each other much on TV, but just to show the viewers how the sausage is made, we sit very close to each other in real life. Yeah, just feet away. Let's talk about this book. The way you tell it, Crownsville was emblematic of shifts in American society, including racial shifts. Was Crownsville a product of systemic racism? Was it a weapon of racism? What did you glean from your work on this?
I think you could make both arguments, but what you see in this asylum is both this very strange and unknown story, but a deeply American one. In that era, in Jim Crow, I think you often think about water fountains or schools as the primary sites where this kind of separation and abuse was happening. But it seeped into everything, including hospitals and our clinical systems. And so in those early years, doctors are openly debating the minds and the bodies of Black people. They've decided that they're somehow inferior and they need to be treated separately, but they simply don't want to pay for it. And so there are already existing hospitals at this time that are treating people with mental illness, but they make this group of patients build theirs from the ground up. And so it's a strange story and it's unusual in that they're the only patients made to do this. But it's a very American story in that from its very roots, from the beginning, this hospital reflects all the battles we know this country has gone through and continues to go through.
And that's a point you make, continues to go through. And one of the things that we saw at Brownsville, as you demonstrated in the story we just showed, is the help that some people got by being treated by people who look like them, who shared their backgrounds. Tell me a little about that.
Yeah, that was one of my favorite parts of the reporting and of writing this book. There is the horror and there is the heartbreak of those early years. But then by the 50s and 60s, a generation of Black men and women who are some of the first Black healthcare workers in this country at all. I mean, they'd previously been barred from working in places like this. They get their foot in the door and they start to change patient outcomes, not because a new medication necessarily has arrived yet, or because there's a new technology that they all get to use. They just see their patients as human. And so they start to do things like call their loved ones and their neighbors to come get them. They start to give them hugs and a level of closeness that the patients hadn't had when they were only treated by people who saw them as unhuman. And so, you know, one of my favorite stories in the book is about this group of Black women who arrive in the 50s. And one of their first acts is just to put patients between their legs and wash their hair and kind of detangle their curls. Those small acts of kindness that weren't present before that helped people believe, you know, I'm worthy of something, or being here at this hospital isn't the end of my life and my story. And that to me is so beautiful. And I think there's this sort of untold story, and there are an entire generation of Black healthcare workers who are still alive in our country in the DMV area today who just haven't gotten their flowers. And so this book is about an institution, but it really is told through the lives and the eyes of the people who were patients and employees there who really lived this.
In Chapter 15, you talk about the Elkton Three, this three young Black Americans who were arrested for attempting to dine in a restaurant right off of Route 40 in Maryland. They were thrown in jail, and they, when they refused to cooperate with the court, they were committed to Crownsville.
Yep. I think that tells you a lot right there. The ways in which in the 60s and then into the 70s, Black Americans protest their concerns about this country, their anger toward this country gets pathologized. And that's part of what you see happen in the institution all the way from the beginning, frankly, until its closure in 2004, within our lifetimes. Is that you see that there's a population of patients there that have actual mental illnesses or are struggling with learning disabilities and things like that. But then there's a population of Black Americans there who are simply just seen as unable to cooperate and get with the status quo, or uncomfortable with the racial order. And so these three civil rights protesters end up in Crownsville for days. And you know, the staff there, they're writing letters on their behalf to get them out of this institution because they recognize there is no real mental illness here. There's no diagnosis. The state, our government, is just angry at them for the crime of trying to eat at a white-owned establishment. And, you know, that story to me is so important, A, because it really hasn't been told. It's not part of our education on the civil rights movement. But B, it's happening at this critical moment, too, where the hospitals are about to start shrinking in the 60s, 70s, and 80s because we're told that they're about to build all these community mental health centers. But the prisons and jails are growing. And so what you're seeing in that story is the way in which our mental health care system started to converge with our criminal justice system. And I mean, now we all live today with a situation in which in most communities in the country, there aren't enough beds for people who are suffering with mental illness. In some communities, your largest provider of mental health care is your local prison or jail. And what I'm showing you in this book through the reporting, through the oral history, is that these aren't coincidences. These were choices. And in many cases, this community was at the center of all those negotiations, and their story just hasn't been told.
Your reporting is some that our viewers have become accustomed to seeing as some of the most important reporting out there, and now it is in this important book. So thank you for writing this important book. We have so much more to discuss, but I do recommend that people read it. Thanks, Antonia.
Thank you.
Antonia Hilton, NBC correspondent and author of the new book, Madness, Race, and Insanity in a Jim Crow Asylum.